you think about these marginalized populations, why do we see these delayed responses? And we're seeing it today. So the stories the last couple of days is this conversation, there's probably better terms for it than a conversation between, let's protect the United States against Zika. And nobody can decide whether they want to do it and how much they want to pay for it. And I often get asked, so Ali, should it be $500 million that Congress wants to give, the 1.9 that the president asked, or the 1.1 that I guess the Senate wants to give, some version? And they're like, I don't care what it is, pick a number, but why are we having this conversation 6 months later? Right? We know what's going to happen. We also know that mosquito control in the United States is not a federal function. It's not even a state function. It's a city and county and district function. And you need to get the money out to these people so they can be doing what they should be doing, which is eliminating mosquitoes and making sure they're identifying cases. And do you have the money to think about, hopefully a long-term strategy would be a vaccine strategy here to protect pregnant women. Do you have some sort of thoughts about, are we funding a vaccine development for a long-term vaccine strategy? And why are we still having this conversation 6 months later, right? Why are we not already doing that? Why are we sort of robbing Peter to pay Paul? So my old program at CDC was responsible for essentially keeping Americans safe from all public health threats, no matter what their nature, if it was pandemics, natural disasters, biological, chemical terrorism. And as part of that program, my passion was for the Public Health Preparedness Program, which put money out into state and local health departments. To help pay for the Zika response, we essentially pulled back some of that money to help support some of the dire activities in other places, including Puerto Rico, where they've already had 1,100 cases, believe it or not. It's tragic enough. My analogy is taking the bricks out of a foundation to build the second story of a building. So if this is our preparedness infrastructure to support the US, why are we taking money out of that to do something like Zika? We should be putting money into the preparedness infrastructure. And what I'll leave you with is a number, because I'm all about observable measures. 6.7. So in the last 3 years, the Robert Wood Johnson Foundation has been doing some great work looking at how prepared the United States is for public health emergencies. And every year gets a little bit better. I think we started at 6.3, but 6.7 out of 10. That's just not good enough for us here if we really want to make sure Americans are protected against public health threats. And as far as I'm concerned, the responsibility of government is to protect us against threats, and that includes public health and health threats. And how can we make sure, I'm old enough now to realize you can't completely strip politics out of policy decisions, and it's not always about the science, but maybe sometimes we need to be stripping a little bit more politics and thinking about what are the health needs of our population.